All right, so the Peroneus Longus and Brevis, also called Fibularis, Longus and Brevis. I like the name Peroneals just because that's what I've been calling them for decades. But the kind of newer name that your textbook is using makes a lot of sense because these are the muscles right along your fibula, right, of your lateral leg bone, right, is your fibula, and then the medial one is the tibia. So you know both names. We got Longus and Brevis are our primary ones. The Longus is more superficial and long, and the Brevis is smaller and shorter and is deep to Peroneus Longus. So let's take a look at these. These are they're strong action because they're on the lateral side and cross ankle on a lateral line. They're very strong everters of the foot, so the outside of the foot going up. There are also weak synergists for plantar flexion. So again, taking a look at these diagrams where you can see the muscles in relationship, and you had worked with these earlier today to kind of help you get a lay of the land. Here we have Peroneus Longus. I'm looking at the lateral view on the right. And again, you really want to think of this as a massage therapist. So you really want to look at the shapes and relationships to what muscles, are going to be anterior to it and posterior to it and deep to it. So, really where are you going to feel or palpate this muscle? And Peroneus longus takes up a big chunk of the lateral leg, and you can palpate it very easily. I massage it, every massage. On this anterior view, you can see it right next to our tibialis anterior. And so you can see that even when you're massaging with the person face up, you have access to Peroneus longus right there. Now, Peroneus brevis is shorter and deeper to Peroneus longus, but like many of our shorter, deeper muscles, there are parts of it where we can access. And in the case of the peroneals or the fibularis, this brevis we can feel on the distal aspect where Peroneus longus becomes tendinous. Peroneus brevis is sticking out on the distal half of the lower leg, and so you can access it there. Now, hopefully you've already noticed that these lower leg muscles, right, they have these long tendons. They cross over, the ankle joint, and some of them attach to, metatarsals, but we're going to start to see that some of them go all the way up to the toes as well. Let's move on and look at the details here of these strong everters. Here we have another, you guys worked on this, you worked on this earlier today to look at the relationship. I think the cross section of the lower leg is great to study. It's going to look different, right, where in the lower leg the cross section was made. But in this cross section, we can see our Peroneus longus and brevis, or Fibularis longus and brevis, right here at D and E. So we can see here is our fibula, and we can see them right there. And of course, the superficial one is longus, and the deep one is brevis. And we can see in relationship where it is in the lower leg in relationship to tibialis anterior, the one, of course, closest to the tibia that attaches directly to the tibia. And then as we move on to our extensor, Hallucis longus is B right here, and extensor digitorum longus. And so those extensor refers to the toes, right? And when you see the word hallucis, it refers to big toe. So this hallucis extensor goes down to extend the big toe, and then the digitorum refers to all the other digits of the toes. So that's what we've got going on here. And here's that view where we can see in the distal aspect of the lower leg on the lateral view, where Peroneus longus at this point is a tendon. And at this point, we can really palpate Peroneus brevis anteriorly and posteriorly to this. And I have felt quite a few folks who kind of have some old injuries in this area, and it can have that sort of dry, kind of crispy feeling that you can really work out some old kind of dry scar tissue in this area quite effectively. I think it's worth really kind of looking at, all these great tendons, and then they're held down by these retinacula. So these thin strips of fascia holding down these tendons. So when we're doing our, MFR in this area, our pin and stretch, et cetera, keeping in mind this arrangement. And as a review, those retinacula, the flat bandage-like strips, are holding down long, skinny tendons to give them better leverage. And here we can see that our peroneals are synergists that are helping with our plantar flexion. And then because they attach, they cross laterally, they're also everters. They're strong everters. And that, again, is the lateral side of the foot going up. So your pinky toe side of the foot going up is your eversion. So our details here of Peroneus Longus and Brevis, or Fibularis Longus and Brevis. Looking at the origin, we're starting with longus. It originates on the head of the fibula. And that head of the fibula is a very palpable landmark if you feel on the lateral aspect, just lateral to the little dimples of your knee. Right around there, again, we just palpated this for plantaris, but you should be able to feel a smooth, round bone that's about the size of, approximately like a dime or a nickel. And so that's a very palpable landmark where Peroneus longus originates. So on that head of the fibula, and then the proximal 2/3 of the lateral fibula. So in other words, the top 2/3. Now, where it attaches is pretty deep, but we can often massage down into the bone. We take a look at where this muscle goes, and it has a long tendon on the distal part of the foot, and then it wraps around the lateral aspect. And then if you take a look at the bottom right picture with the bottom of the foot, or the plantar side of the foot, you can see this tendon wraps all the way across the foot to attach to the first metatarsal and medial cuneiform. And you'll see a couple muscles on the foot that wrap all the way under the foot like stirrups. And these are part of what supports the arches of the foot. You might remember that from our intro to biomechanics of the foot. Any questions?
So could you do a Gto release on this muscle here?
Yeah, that's a great question. If you can get your fingers around that tendon at all, then yes. And where you can do that usually is the part right around the ankle, or right around spleen 6. I'm sorry, that is not spleen 6. Whew. Spleen 6 is on the medial side. That's the gallbladder side. But yeah, sometimes you can get your hands around the tendon right there. This is the strong plantar flexor and also an everter of the foot. And then our Peroneus brevis originates on the distal 2/3 of the lateral fibula. Again, so it starts on the distal aspect. And on this picture on the left where I just outlined, this is, of course, with Peroneus longus reflected, or in other words, removed in the drawing. You can see it pulled away here. So this is deep of course, to Peroneus Longus. And then it inserts on the tuberosity of the 5th metatarsal. So it has also a long tendon that wraps around the lateral malleolus. It wraps behind the lateral malleolus. That's palpable, those tendons, and inserts on the tuberosity of the 5th metatarsal. And as I showed you in other diagrams, now I'm looking at the diagram on the upper right, and a great place to palpate and massage Peroneus brevis is in that distal 2/3 aspect of the lower leg. Because Peroneus longus has turned into a tendon at that point, you can really palpate Peroneus brevis pretty easy there. So both of these muscles are very easy to palpate and massage. And I massage them very, very often. You know, anytime folks have tension in their lower legs or problem with their feet or you know, their movement, these muscles are great to work with. And these are complete synergists. They have the exact same actions as each other. They work together. So questions on those? All right. Cruising through.